This is the armpit test, and it helps you understand whether your pain in your neck and shoulders is coming from your shoulder blades, which are sitting too low. First of all, we want to test and see where your pain is. So I'm going to ask Ashley to rotate her head to the left and to the right. She's going to look up and down. And what she's doing is getting a feel for where's her pain, how sharp is it, how far can she rotate her head from one side to the other or look up and down. Wherever that is, that's where her baseline is. Okay. Now, what I'm going to do is I'm going to lift up her shoulder blades. And I'm just lifting them up maybe a ½ inch or an inch at most. And I'm moving them around a little bit to help her release that tension that she's used to holding in that area. People with chronic neck and shoulder and arm pain, basically it's very difficult for them to let go of this in their shoulders because they're so used to having tension and pain here. So jiggling this slowly like this helps them release that and let you hold it. The goal here is for them to allow me to hold everything up. And again, I'm only holding it up maybe a ½ inch or an inch at tops. All right, so let's say I've been holding this for about 15 or 30 seconds and she's done a nice job of relaxing. I'm going to ask her now while I'm holding it up to rotate your head to the left and right, look up and down and see if there's any improvement in your range of motion or your pain, anything like that. If there is, it's telling us that the weight of the shoulder girdle is contributing to the neck pain, the shoulder pain, or whatever pain they're experiencing. All right? So then the second part of the test is that we lower this back down and let her have her shoulder blades back. And then I ask her to rotate her head to the left and right and look up and down again. If the pain... All right, for this test, what we want to know is whether you're bringing your shoulders down and back to create good posture. Here's what it looks like from the back. Are you doing this to create good posture? From the side, it's going to look like this. Are you doing this to create good posture? Are you holding your shoulders back in order to keep yourself nice and tall? That's the quiz. Yes or no? All right, one of the things we want to do is make sure that there's nothing really serious going on with that shoulder. And there's a really easy test to do to test for a rotator cuff tear. So I'm going to ask Ashley to bring her arms up like this. So what I'm first looking for is to see whether this shoulder is hiking up like this to do that. If it is, it's telling me that there may be some structural damage in that shoulder, like a rotator cuff tear or something like that. All right, and once she's holding it up like this, we're going to push down, hold it up, hold. And so what I'm looking for is A, to see how strong she is, but also to see whether this shoulder starts to hike up more. And if it does, it's telling me something may be going on here with that rotator cuff muscle. All right, so if we rotate the thumbs down like this, this now really isolates the primary rotator cuff muscle, the supraspinatus. So we're going to hold it up like this. Again, I'm going to look to see whether this is starting to hike and whether she's having trouble with that or it's painful. And if she's doing okay, then I add a little bit of pressure and you hold that up, Ashley. Hold. And I'm pushing down maybe 10 pounds, so it's a little bit of pressure here. All right, and again, we're looking to see whether that's hiking up. If she's doing okay with that, then I'm feeling pretty good that she doesn't have a rotator cuff tear. But if she